Look at that wind right there. Not only is the water, these are about some of the worst conditions I have ever been in during this type of a hurricane here. Look at that wind right there. Not only is the water body,
Reserve reconnaissance aircraft data indicate that Harvey has become a Category 4 hurricane, of 130 miles.
There's a small child on top of that one gentleman there. The water. This is what Buffalo Bayou looks like.
Hurricane Harvey left Houston and surrounding areas devastated. Pediatricians and regional response organizations were on the front lines of preparing communities and keeping families safe. Environmental hazards develop from hurricanes and associated flooding. Children are more vulnerable to these environmental exposures. Now more than ever, it is important to partake in advanced planning and preparation for disasters to keep our children safe.
High five! All right, good job.
So SETRAC is the preparedness organization for healthcare and the surrounding entities in a 25-county region. Before a disaster, we're responsible for training, educating, making sure that they have the necessary equipment and supplies in order to respond in their own facilities to disasters. So the advice that I would give to businesses or healthcare facilities that are out in the communities, even the large organizations, is to make sure that you've got a plan that's workable. When you exercise your plan, you should fail. You want to be able to learn a lesson each time you exercise to make your response better. If we need to move a nursing home to another one. Correct. And then
as a clinician practicing in a community, it's important for you to know what the local chain of command is, know what the city or the town's plan is for addressing a disaster. You may lose your office. It's important to make plans for where you might be able to see your patient if your office is damaged and you're unable to take care of your patients. The other thing that I would suggest is that you have a grab-and-go bag, which contains an otoscope, an ophthalmoscope, a stethoscope. That's about all we need.
Perfect.
Anyone wants the VOIP Hurricane Net, we will pass it over to Carlos, XD2W.
Usually follows us.
During emergencies like this, people fall and they cut themselves. And so it's very important in the aftermath of a disaster to have vaccines readily available.
When examining patients after a hurricane, providers need to be attentive to clinical manifestations caused by environmental exposures.
On boats. We even saw a jet ski go back there just a few minutes ago, but it's just so devastating to see these families. See, even on this raft, there's 2 small children on there.
About an hour ago.
Burning.
The Houston-Galveston area is one of the most culturally diverse areas in the country. And as such, we clinicians need to be attuned to that. In terms of the children that we take care of, a large proportion represent an underserved population, economically disadvantaged population.
Those individuals are very vulnerable in the time of disaster and storms. I recommend that they contact their churches, they contact their places of worship, their local leaders in their communities, and can actually help them maneuver through getting prepared.
As a pediatrician, one of your responsibilities is patient education. Those of us who live in hurricane-prone areas, part of that patient education is to talk to your families about being ready for a hurricane, being ready for a disaster.
Families need to start preparing early. You should start in April or May, in the springtime. The weather is beautiful, people want to be out in the parks, they want to be playing with their children in the backyard, but that is the time, not the time when the weather comes up and says we have a hurricane in the Gulf.
One of the things that's important for the healthcare provider to do is to encourage their patients to have a plan, develop a plan. What are you going to do if a hurricane is likely to come ashore?
You want to make sure that your important documents and your important essential supplies are waterproof. If you're on medications, place them in a waterproof pouch.
As a healthcare provider, do you have a plan for your own family?
We've had a lot of success stories in this area of hospitals that every single day are competitors, but when the time comes to pull together in a disaster, they are all in it together. The names don't matter. It doesn't matter what system you're in. This is our community, and we're going to provide the care for it. They know that they need to help each other to care for the vulnerable populations that are out there.
While it may be impossible to prevent storms and disasters, we can help children cope more effectively. Preparedness is key to adapting and thriving in our changing environment. The Pediatric Environmental Health Specialty Units are here to help. To find out more, go to PEHSU.net.